Doctor, I've been hearing this a lot lately. Is it true that people with diabetes are more likely to have a heart attack?
That's a great question. Diabetes is mainly known for raising blood sugar levels, but it also affects your blood vessels in a big way. When your blood vessels are damaged, it speeds up a condition called atherosclerosis, which makes you more likely to have a heart attack.
Wait, does that mean everyone with diabetes is going to have a heart attack? That's terrifying.
No, not everyone. But certain people with diabetes are at a much higher risk. Today, I'll explain the key traits that can make someone with diabetes more likely to experience a heart attack.
I'm all ears, doctor. Please tell me more.
The first and most important factor is poor blood sugar control over a long period of time. If your blood sugar stays high for too long, your blood vessels start to take damage.
High blood sugar damages blood vessels? How does that even happen?
Simply put, when blood sugar is high for a long time, it harms the inner lining of your blood vessels. That causes inflammation, which thickens and narrows the vessels, making it harder for blood to flow. That's called atherosclerosis, and it's a major cause of heart attacks.
Whoa. So how long does it take for this to become a problem?
It varies, but when your HbA1c, a long-term measure of blood sugar, stays high for years, the risk really goes up. Especially if it's consistently above 7%, the chance of heart attack increases significantly.
So if someone has high blood sugar right now, they need to act fast?
Exactly. But the good news is, with proper treatment, healthy eating, regular exercise, and medication if needed, you can protect your blood vessels and lower your risk.
Got it. But is blood sugar the only thing we should worry about?
Actually, no. Conditions like high blood pressure, high cholesterol, and obesity, if they occur alongside diabetes, make the risk even greater.
So if someone with diabetes also has high blood pressure and is overweight, their risk is super high?
That's right. High blood pressure puts extra strain on your blood vessels. High cholesterol can lead to plaque buildup, which can block blood flow. And obesity makes it harder for insulin to work, making blood sugar control more difficult.
That sounds like a direct path to a heart attack. What can we do to prevent it?
First, you need to improve your diet. Cut back on salt and fat, and eat more vegetables and fish. Then, get regular exercise. Something like a 30-minute walk every day is a great start. Just don't overdo it all at once.
Exercise really is important, huh? Are there any other risk factors?
Yes, another big one is diabetic neuropathy. When someone has had diabetes for a long time, the nerves can become damaged and less sensitive to pain.
Wait, what does that mean?
It means that even if you're having a heart attack, you might not feel the typical chest pain. This is called a silent heart attack, and it can be especially dangerous because you don't realize what's happening.
That's scary. Is there anything else I should watch out for?
Absolutely. Smoking is another major risk. Cigarettes make your blood vessels narrow and speed up atherosclerosis. If you have diabetes, the effects of smoking are even more serious.
Yeah. I've heard smoking is bad, but this makes it sound even worse. Is there one more risk factor?
Yes, the last one is age. As we get older, our blood vessels naturally stiffen, which makes atherosclerosis more likely. Older adults with diabetes should be especially careful.
So how can we lower these risks?
There are 5 key steps. Manage your blood sugar properly. Improve your overall lifestyle habits. Get regular heart checkups. Speak to your doctor if you notice any unusual symptoms. Avoid stress and get quality sleep. Stress can raise blood sugar and damage blood vessels, so taking time to relax and rest is really important too.
That makes sense. I want to remember the traits that increase heart attack risk for people with diabetes. Can you go over the 5 main ones again?
Of course. Let's recap. Poor long-term blood sugar control, this damages blood vessels and speeds up atherosclerosis. Regular blood sugar checks, a healthy diet, and exercise can help. Having other conditions like high blood pressure, high cholesterol, or obesity, these combined with diabetes make heart attacks more likely. Balanced eating and regular physical activity are key. Diabetic neuropathy, nerve damage can make it hard to feel heart attack symptoms, like chest pain. Be alert to signs like shortness of breath or unusual fatigue. Smoking, this narrows blood vessels and worsens atherosclerosis, especially dangerous for people with diabetes. Quitting smoking is highly recommended. Older aging causes blood vessels to harden, so older adults with diabetes should get regular checkups and make healthy lifestyle choices. By focusing on blood sugar control, improving habits, getting checkups, quitting smoking, and managing stress, you can significantly lower your risk of heart attack.
Thank you so much, doctor. That was really clear. I'll start making changes today.
That's fantastic. Let's work on it together. You don't have to be perfect from day one, just start small and keep going. The key is consistency. With the right knowledge and early action, you can greatly reduce your risk.
I see. So I don't have to do it all at once. I'll take it step by step. Thank you for all the helpful advice today. I'm going to be much more careful with my health from now on.
And thank you for staying with us till the end. We've got more videos on diabetes, so feel free to check out any topics that interest you. Let's keep working on your health together.